I'm Dr. Hedberg with the International Medical Crisis Response Alliance, or IMCRA, which is a UN-affiliated medical education initiative. This video module has been developed and produced by IMCRA for your information and use during the coronavirus pandemic. Its primary purpose is to provide you with basic but accurate medical information derived from the most recent U.S. Center for Disease Control analyses and the latest epidemiologic and virologic research. Its secondary purpose is to help you sift through the barrage of data already online and disregard bogus or inaccurate information. Please feel free to direct anyone toward this site and this video module at any time. In fact, we encourage you to do so. This video module presentation and contents are the property of IMCRA and are protected by international copyright law. The coronavirus, or COVID-19 pandemic, is upon us worldwide and needs to be halted as rapidly and effectively as possible. An epidemic spreads easily when people are unaware of its mode of transmission and its symptoms. Worse, when ineffective measures are used to combat a disease, its spread is assured. While at present this disease is fatal in only a small number of cases, COVID-19 presents a very definite danger because of two factors. A, the ease with which it can be transmitted or spread, and B, the danger that it will mutate into a form that is even more virulent and deadly. Both of these dangers are tied to the infection of large numbers of people worldwide. COVID-19 has now been diagnosed in nearly 100 locations globally, including the United States. The two factors I referred to earlier can only be diminished by limiting the number of total infections. Because this disease can be asymptomatic in some persons, there is also the danger that it can be unknowingly spread by people who otherwise appear to be completely healthy. Accordingly, control may require the ending of certain practices, for example, shaking hands and greeting, which, while contrary to accepted social norms, are important in disease containment. So first, let's start with some basic information about the virus itself. Coronaviruses have been around for a long time. Both SARS, the severe acute respiratory syndrome, first reported in 2003, and MERS, the Middle Eastern respiratory syndrome, first reported in 2012, were coronaviruses. The disease called COVID-19 is caused by a coronavirus properly called SARS-CoV-2. This is a novel form of beta coronavirus which appeared in Wuhan City in December 2019 and may have originated from an animal source, probably bats, in an exotic foods market. The U.S. Center for Disease Control notes, or CDC, notes that at present, COVID-19 is transmitted through skin contact and through airborne aerosol sources. Since there is no cure for the disease, nor any way to kill the virus once it has invaded the body other than the natural immune system, the best approach is prevention and containment. Since preventative measures involve relatively simple techniques, we will delineate them here in detail. First for the cutaneous or skin-related route of transmission, and then for airborne transmission. Number one, you've heard this before, but it's critically important. Wash hands with soap and warm water for at least 20 seconds, or rub hands together using an alcohol-based sanitizer. The best is approximately 60% alcohol. Do this as frequently as possible, and particularly after touching any surface that may have been touched by others within the last 48 hours. Some examples we may not commonly think of include door handles, public touch screens, stair railings, elevator buttons, common use tables, coffee pots, or other implements that may have been handled by an infected person. Use a tissue, your sleeve, or a glove to cover your hand or finger if you must touch something, and avoid touching your face, nose, or eyes thereafter. Also, be aware that coins and paper money may be vectors for virus transmission, so please use care when conducting cash transactions. When at home, clean and disinfect frequently touched surfaces, such as tables, doorknobs, light switches, handles, desks, toilets, faucets, sinks, and of course cell phones. Also, be sure to have all medicines and medical supplies needed for fever and other symptoms. Have enough household items and groceries for an extended stay at home and a self-quarantine, which can happen quickly if needed. In social or business interactions, remember, avoid shaking hands with others for now, and keep approximately 5 feet away from anyone who may be ill. When in public, attempt to avoid crowds, especially in poorly ventilated spaces. The risk of exposure to COVID-19 is increased in crowded settings with little air circulation if there are people in the crowd who are or who may be ill. Wearing a face mask properly and using it to cover your nose and mouth securely is recommended if COVID-19 is identified in your community. Take extra measures to put distance between yourself and other people if that is the case. Overall, stay home as much as possible if you are ill, and if appropriate, consider ways of getting food brought to your house through family, social, or commercial networks. When at home or at work, be aware of potential COVID-19 symptoms such as fever, cough, and shortness of breath. If you feel you are developing symptoms, get medical attention immediately. Emergency warning signs include difficulty breathing or shortness of breath, persistent pain or pressure in the chest, confusion or an inability to arouse yourself properly, and in more severe cases, bluish lips or face. The incubation period for COVID-19 is estimated now at 2 to 14 days. Frequently reported signs and symptoms in patients admitted to hospital include fever in 77 to 98%, cough 46 to 82%, myalgia or fatigue in 11 to 52%, and shortness of breath in 3 to 31% at illness onset. Less commonly reported respiratory symptoms include sore throat, headache, cough with sputum production, and hemoptysis. Finally, there are some physiologic preventative measures you can take to avoid getting very sick, even if exposed to the virus. While these provide no guarantee, since this current virus is novel, these measures may help you fend off serious illness. First, if you're planning a vacation to a warm location because you've heard heat kills the virus, you may as well stay at home. While warmer temperatures, different humidity, and fewer indoor crowds may limit transmission, there is currently no evidence that heat will prevent the illness, and frankly, more chance that the travel itself will cause you to come into contact with the virus. If you can stay at home and still get the natural sunlight you're looking for on vacation, you will receive the same benefits. For example, a vitamin D boost and improved immune response. Second, overall, the best technique is to keep your immune system strong. So get plenty of sleep. Get vitamin C from citrus and other sources. Drink plenty of water for hydration. Continue to exercise. And make sure you're getting enough vitamins and minerals through a healthy diet or through dietary supplements. Finally, it may also be wise to get a flu shot if you haven't already, as it will prevent you from getting influenza and its potential complications if you're exposed to COVID-19. For further information and updates, please visit us at www.imcra.net or Google us at imcra/globalgiving.org. Thanks very much for your attention and good health.